So surgeries for pancreas, particularly in cancers, can vary from removing only a very small portion of pancreas to removing the entire of the pancreas. So pancreas extends from right side of the body to the left extreme of the body. So as such, it can be divided into head of pancreas, body of pancreas and tail of pancreas. So very small tumors which are not cancer type of tumors, like just short of cancer, we can sometimes go with just removal of that tumor alone, which is called as enucleation. If tumor is slightly bigger and it is present exactly in the middle, then we can do something called as median pancreatectomy or central pancreatectomy, in which both head of the pancreas is preserved and tail of the pancreas is also preserved. But most commonly what we get as cancers is the cancers at the head of pancreas, because these cancers produce symptoms early and they do present to doctors early. So in these conditions, what we do is we remove the head of pancreas, but uniquely we cannot just go off with removal of head of pancreas alone, because it is very closely associated with initial 25 centimeters of the small intestine and also the bile duct. We end up removing these organs also, that is 25 centimeters of the initial small intestine and also the distal portion or the terminal portion of the bile duct. So it's a major surgery per se. It is otherwise called as pancreatoduodenectomy or the Whipple's procedure. Now if some tumor is present in the body and tail, big enough tumor, then we do what is called as distal pancreatectomy, in which we preserve the head of the pancreas and we remove the body and tail of the pancreas. Many a times if it is a cancer, we will end up removing an organ close to that called as spleen. But though spleen has got very important function in the childhood, in adult the functions of spleen are not very significant, and hence removal of spleen will not have that much impact of one's health. So as such, the surgeries of pancreas, there are so many types. Most complicated one is the Whipple's procedure and least complicated is the enucleation procedure, and less complicated thing includes a distal pancreatectomy. Now whether these surgeries should be done only in open, only in laparoscopy, only in robotic, no, it can be done in all these three ways. The advantage of laparoscopy and robotic procedures is the incision will be less, infection will be less, pain will be less, recovery will be faster, ICU stay, hospital stay will be less, and hence patient getting back into their normal work will also be earlier. Again, though it is a cancer, not only in open surgery we will be removing the entire cancer, even in laparoscopy and robotic we can remove the entire cancer. Particularly the vision is enlarged, 4 to 10 times enlarged vision makes us to ensure that we don't leave any portion of the cancer behind. So these are the kinds of surgeries of pancreas, the complicated one being the Whipple's procedure, a simple one being the distal pancreatectomy. Thank you.